Destination, Thailand.
We are headed to Bangkok and the hill tribe villages and the refugee camp areas.
The student group will be traveling to a remote tribal village where access to health care is limited and tropical diseases are circulating.
The trip is about community building, really to see the world beyond just New Hampshire, New England, or even the United States.
The recommended first stop? The Dartmouth-Hitchcock International Travel Clinic.
How many of you are travelers?
Dartmouth is a great hospital, and they know everything about the places we're going, and meeting with the nurses and having all the various people here gives the kids a sense that it's a serious matter.
What will the arrangements be? Do you know who's cooking, where you'll be having your meals? Will they be out at restaurants or?
Why all the questions?
I want them to be informed. I want them to understand what the risks are and how to mitigate those.
The travel clinic fields a lot of questions too.
Certainly travelers want to know what is safe to eat, how do they appropriately clean their water before consumption, do they have to brush their teeth with bottled water, for example.
Whether it's vacation, a medical mission, or a school trip, knowing the do's and don'ts of international travel is essential.
Let's start with the water. Any water that you drink really needs to be boiled, bottled, or chemically treated. You don't want any dairy products, cheese, milk, anything that has not been pasteurized.
No one wants to be a wet blanket, but
we know for a fact that diarrhea is a problem in about 50% of travelers who go to the tropics for 2 weeks or more.
Be prepared for it and bring some Imodium, which is an over-the-counter anti-diarrheal medication.
It's not going to be as simple as I thought it was going to be.
A traveler's itinerary will dictate what vaccines are needed.
My guess is most of you will be getting the typhoid vaccine.
Travel clinic appointments should be booked at least 6 weeks prior to a trip, as some immunizations will take that long to become effective.
Anything that would impact your immune system in the last 6 months?
No.
Travelers are also counseled on mosquito precautions.
This isn't just like black fly season in New England. You're preventing illness.
Infected mosquitoes can spread diseases like malaria.
Malaria is highly endemic and in some places epidemic. We prescribe a pill that a traveler can take to try to prevent the malaria that's circulating in the area.
As for more commonly encountered health hazards,
water bottles, making sure the seals aren't broken.
I'm not going to touch animals and get near monkeys. I don't want to get bitten by them.
Sunscreen first, 15 minutes, mosquito repellent.
So once the medical histories are taken, the bug spray and sunscreen packed, and everything's said and done, what will these travelers know before they go?
A lot of little things that I never would have thought of.
And that's the point.
I definitely recommend this to anybody who is, thinking about going abroad.
With a little foresight and a few preventive measures, you can stay safe and healthy no matter what the destination.